My name is Tatyan Clarke. I'm a surgeon and assistant professor of surgery at Temple University School of Medicine, and my practice is in bariatric and minimally invasive surgery. I've always wanted to be a surgeon, actually. It's the only thing I've ever wanted to do. So it was, since childhood, basically, was my goal, and it's been my focus throughout my life, is to ultimately become a surgeon. I did my residency at the University of Southern California, and then a minimally invasive surgical fellowship at the Mayo Clinic in Florida. Bariatric surgery is essentially weight loss surgery, but the practice is focused at both the metabolic changes that are associated with obesity as well as the lifestyle consequences that come with obesity. A lot of our patients have multiple medical problems: high blood pressure, diabetes, sleep apnea, high cholesterol, heart disease, and these are diseases that compound over time in association with their weight. That, combined with the fact that they get joint pain, back pain, that these are people whose lives are challenging for them because they have a certain sense of how society looks at them. It's also really a multidisciplinary, integrated practice where we take patients who are having that experience and give them the knowledge about nutrition and lifestyle changes that enable them to lose weight in combination with the operation in a way that ultimately can lead to improvement in those medical problems. Minimally invasive surgery basically is the practice of performing big operations through small incisions. So ultimately, all of the 4 operations that we perform at Temple Health are performed laparoscopically, which essentially means that small incisions are made on the abdomen. The process of having a bariatric operation really is not as simple as just walking in and signing up and having your operation done. It's really an integrated approach with dietitians, psychologists, nurses, and a really integrated team that we have here that focuses on giving people the knowledge of how their life needs to change to get what they want. We want our patients to follow up for a lifetime after the operation in order to allow us to help monitor their health, yes, but also monitor that process and help support them to maintain the results that they've had. One of the things that our program offers that's unique is the fact that the surgeons, the dietitians, the psychologists are all as deeply involved in the patient's process before and after surgery. We get a lot of feedback from patients that they're surprised at how often they get to meet with a dietitian. They're surprised at how often they get to see the surgeon and how many visits they get with a psychologist. Because it's not just for us, it's not about checking off the box. It's, did they get what they needed from the dietitian? Did they learn what they needed from the psychologist? Have we helped them make their way through the process? Because in the end, we want the changes to be lasting. And a lot of times people need support to get through that.